Today I would like to share important information with you about living with congestive heart failure. Finding out you have congestive heart failure can be scary, but congestive heart failure just means that your heart does not pump enough blood to meet your body's energy needs. Slow blood flow causes blood to back up or become congested, robbing you of energy. You may feel tired, your feet and ankles swell with extra fluid, and simple activities make you short of breath. Proper treatment, including proper diet, medication, and lifestyle changes to slow the advancement of congestive heart failure, help you feel better, live longer, and be more active. You can manage your congestive heart failure by remembering the key factors. Know your type of heart failure, eat a healthy diet, record a log of your daily weights, report early signs of worsening CHF, and keep your regular health care provider visits. Symptoms of CHF include running out of energy easily. Shortness of breath from routine activity wakes you up from sleep or when lying down. Puffy, swollen legs, ankles, or feet. Poor appetite or nausea. Weakness, dry, nagging cough, or rapid weight gain, which is 3 pounds a day or 5 pounds or more a week. There are two main types of heart failure. Because each type is treated differently, it is important that you understand what type you have. To find out what type of heart failure you have, your doctor may order an echocardiogram, echo. An echo uses ultrasound waves to show an image of your heart as it pumps. Normally 60% of the blood in the heart is pumped out with each heartbeat. The percentage is known as your ejection fraction, or EF. The first kind of heart failure is called diastolic failure. When your heart is thick and stiff, you have diastolic failure. Your ejection fraction may be normal, over 40%, but your heart resists filling with blood because it cannot relax. Pumping against blood pressure is the most common cause of this type of heart failure. Thick walls are a sign of diagnostic heart failure. When we talk of thick walls, we're talking about the heart wall itself here being thick versus normal. My model is a lot larger than the normal heart. Our heart is normally the size of our fist, center left of our chest. So if I look into the left ventricle of the heart, you can see this heart wall thickens with diastolic heart failure. A weak heart muscle is known as systolic heart failure. Your ejection fraction is 40% or less. Most people with this type of heart failure are heart attack survivors. Their muscle is left too damaged to pump well, and these heart walls are narrower. They're thinner than what the normal heart wall should be. The main treatment for congestive heart failure is medication. Medications are used to help relieve symptoms, boost your energy, keep you out of the hospital, and help you live longer. The key is using them exactly as directed. Know your medication doses, the time of the administration, and their side effects. Take your medication at the same time every day. Do not stop taking or change medications unless you first talk with your doctor. Do not decrease the drug's dosage to save money. Take the full amount prescribed to get the full benefits. Talk with your doctor about ways to reduce drug costs as needed. Even if you feel good, continue to take your medication. Stopping these drugs suddenly can make the condition worse. Remember to keep your list of your medications with you at all times. Before using over-the-counter treatments like pain relievers, cold remedies, vitamins, and herbal products, check with your doctor or pharmacist to make sure they don't interact. Some drugs such as antacids, salt substitutes, antihistamines, and nonsteroidal anti-inflammatory agents can worsen heart failure symptoms. If you forget to take a dose, take it as soon as you remember. However, if it's almost time for the next dose, ask your doctor about skipping versus making up the missed dose. Do not wait until you're completely out of your medications before filling your prescriptions. If you have trouble getting to the pharmacy, have financial concerns, or other problems that make it difficult to get your heart drugs, let your doctor know. And when traveling, keep your medications with you so you can take them as scheduled. On longer trips, take an extra week's supply of medication and copies of your prescriptions in case you need to get a refill. Keeping your blood pressure under 120/80 to prevent further heart failure from getting worse is very important. Eat a healthy low-sodium diet. Avoid salt. Sodium, also known as salt, is a mineral that makes your kidneys retain fluid. Eating too much sodium can cause fluid overload, requiring hospitalization. Eat no more than 1,500 milligrams of sodium a day. Remember that 1 teaspoon of salt is equal to 2,000 milligrams sodium. Select food labeled sodium-free, low sodium, or very low sodium. Herbs, spices, and lemon juice can perk up the flavor of most foods. Before using a salt substitute, ask your doctor which ones are safe for you. Avoid processed, cured, and canned foods unless they are low in salt or sodium. Avoid tobacco. If you smoke, stop. Talk to your doctor about programs and medicines to help with this. If you have severe heart failure, you may need to limit the fluid you drink to take no more than 2 quarts a day. Do not drink alcohol, as it can further weaken your heart's pumping force. Most people benefit from a light to moderate exercise program. Increased activity is tolerated while balancing exercise and rest periods. Walking can improve your strength and energy level and lift your spirits. General exercise guidelines include: do not exercise for 1 hour after eating. Avoid exercising in extreme temperatures above 85 degrees or below 40 degrees. An alternative is to walk in a closed building or around the house. Consult with your medical provider for activity limitations before using exercise equipment and the opportunity to participate in a cardiac rehabilitation program. Listen to your body. Your body will tell you when you are overdoing it. You should be able to speak without feeling or sounding short of breath. Symptoms of overexertion include dizziness or feeling lightheaded, rapid or irregular heartbeat, or cold sweats. If you exhibit one or more of these symptoms, stop and rest immediately. Then resume at a slower pace after resting. If symptoms don't resolve with rest, notify your healthcare provider. Catching the flu or pneumonia is much worse when you have congestive heart failure. Protect yourself by getting a pneumonia and annual flu immunization. Weight gain is the earliest sign of worsening congestive heart failure. Catch it early so that your doctor can adjust your medicines and prevent a hospitalization. Keep a log to record your daily weight. In the book that you have, there's a page where you can do the recording of your weights. This log is the one we need you to take to your doctor's appointments. Weigh yourself every morning at the same time upon awakening. Empty your bladder, and before eating, with the same clothing or no clothing, record your weight from the same scales. This is called a dry weight. Consult your doctor if you gain over 3 pounds a day or 5 pounds in a week. Bring your weight log with you to your doctor's appointments. A summary of the key concepts to manage congestive heart failure is included in your congestive heart failure booklet. Place this magnet, which is inside your booklet, in an optimal location to review frequently. Applying this information will give you powerful tools for successful management of your CHF. Please consult your medical care provider for further questions. Thank you.